Good afternoon. I want to extend a warm welcome to all who are with us today, both in person and watching virtually, to the University of Nebraska Medical Center College of Public Health Convocation Ceremony. I'm Nicole Collum Valdivia, Assistant Dean for Academic Affairs in the College of Public Health. Thank you for joining us on this special day. Now, if you're able, please stand for the processional. Please be seated. It is my pleasure to introduce Caitlin Mitchell to give the invocation.
On this day, we are blessed with the presence of family and friends who have cared so deeply over the course of our lives. We remember those who cannot be with us today and hope they are proud of what we have become. We are grateful for the guidance and support for those who have mentored us over these past years. Today, we begin a new phase of our lives full of new beginnings and possibilities for our futures. We ask you to join us on this day of recognition and celebration in the hope that our actions will prove worthy of the confidence placed in us today. For these things and the intentions we hold silently in our hearts, amen.
Thank you, Caitlin. Now it is my pleasure to introduce the Dean of the College of Public Health, Dr. Ali Khan, to say a few words and introduce our invited guest speaker.
Good afternoon, everybody. And thank you, Dean. You noticed the word she said, few. I wonder, was that on purpose? So as I stand in front of you with all these pomp and circumstances and these medieval robes, I guess it's a reminder of the responsibility, honor, and privilege we have of training students here at the University of Nebraska Medical Center and getting them ready for our outside community. But I do want to remind you all that it's a convocation and it's a celebration. And that's the type of mood we like to maintain at this event, that it truly is a celebration of you and our graduates. So, dear esteemed faculty, staff, family, friends, and graduates, welcome to the Fall 2024 College of Public Health Convocation. This will be my 10th year here as Dean, and I've been delighted at each and every one of these events. It really is an honor and privilege to share this momentous occasion with you. So today, we will celebrate the culmination of years of dedication, perseverance, and relentless pursuit of knowledge. Graduates, your achievements are a testament to your commitment to improving the health and well-being of our communities. But as we will acknowledge your individual accomplishment throughout the course of the next couple of days, let us also recognize the invaluable contributions of those who supported you along the way. And that specifically, the parents, the partners, the family members, friends, who provided their support for you and encouragement throughout this event. So before we celebrate our graduates, I would like to actually celebrate all of the individuals who helped our graduates to be successful. So if you would care to rise and are able to rise, let's celebrate your family, parents, and friends. So thank you very much for what you've done. The students will be doing a lot of rising. So let's start with the parents and the family and the friends who actually helped them get to where they are. And to our esteemed faculty and staff, it was your mentorship, it was your guidance, it was your expertise that really helped shape these graduates and instilled in them how they are going to become the public health leaders of tomorrow and how to think about their role in communities as people and service and a commitment to social justice. So if I could ask you to rise and to be recognized for what you have done to help prepare our graduates. So graduates, now it is about you. You're entering the field of public health at a time of unprecedented challenges and opportunities. The COVID-19 pandemic really underscored the critical importance of public health infrastructure, preparedness, and effective communication. And unlike previous years, I no longer need to start by explaining public health to your family and friends. People know what public health is, and they know the critical role it plays to maintain the health and safety within our communities. But as we move forward, we really need to learn from the lessons of the past and embrace more innovative solutions to address the evolving health needs of our communities. In addition to the ongoing challenges posed by infectious diseases, so without a doubt, there's always a risk of a next pandemic, but you are going to face a multitude of other contemporary and public health issues. So this includes chronic diseases, which is a major focus currently, the growing burden of mental health within our communities. You see this, you read about this every day, the health impacts of climate change, and of course, the persistent disparities in health outcomes we see amongst different populations across our state, across our nation, and across the world. Now, as you navigate these complexities of public health, remember the lessons you've learned from some of the ways we've tackled the recent challenges to public health. So I like to quote, you have heard me say it before, 2,300 years ago, Hippocrates said, there are in fact two things, science and ignorance. The former begets knowledge and the later begets ignorance. So I'm hoping that we will be good stewards of good science moving forward and embrace the power of data, technology, informed decision-making, and drive impactful interventions. And with that science, to advocate for policies that promote health and address the social determinants of health, and ensure that everybody in our community, no matter who they are, can live a healthy life. And most importantly, if there's one lesson I've learned and that I try to impart from the last few years of COVID, is that there's nothing more important than trust. And how do you build trust with your communities as you move forward? So I'm going to urge you to approach these challenges with a spirit of innovation, collaboration, and again, that deep commitment to justice. I remember addressing many of you when you first came in with the dean's orientation and saying that the foundation of public health is social justice, and that's the health of each and every individual within our community, and that has not changed. And I hope you will continue to remember that part of my message as you move into your careers. Be bold in your thinking, challenge the status quo, and seek out opportunities to create positive change. And I also want to remind you again that the work that you do as public health professionals, I really see it as the work of life, right? It's the air we breathe, it's the water we drink, it's the food we eat, It's the safety of the places you live, work, learn, and play, right? It's a planet we live on. I mean, that is the essence of life. And that's the work that you do every day to ensure that safety and health within in those spaces and places. So your power to improving health incomes has a ripple effect throughout our communities and the way we live, work, play, and learn. Now, as you leave this institution, I encourage you to stay connected to your alma mater. We are proud of your accomplishments and eager to support you in all of your future efforts. I guess now I'm going to have to turn it over, but before I turn it over to my guest speaker, I really want to congratulate you one more time. You inspire me every day and refresh my sense of wonder. I tell people I whistle to work every day, and you're one of the main reasons I whistle to work every day. Now, so go forth, be good public health guardians, stewards of our nation's health. The world needs you, and you have the ability to make a difference in the world. Your passion, your knowledge, your commitment to public health really will create a brighter and healthier future for all of us. I hope that was brief. And now it's my pleasure to introduce our convocation speaker, Dr. Brian Krasushi. He's an epidemiologist, public health practitioner, and president and chief executive officer of the Beaumont Foundation. I've known Dr. Krasushi for over a decade or so at this point, really a true public health leader, innovator, and big thinker about public health and the role of public health in our communities. With the help of a strong team, Brian has built the foundation into a leading voice in health philanthropy and public health practice. Under his leadership, the foundation is driving change to improve population health, foster collaborations between public health and other sectors, prioritize the importance of communications, and strengthen our nation's public health infrastructure. City Health, the Build Health Challenge, the Public Health Communications Collaborative, Health Action Alliance, and the Public Health Workforce Interests and Needs Survey are among some of the many high-profile projects that he has helped create while at the foundation. Prior to joining the Beaumont, he worked for a decade as an applied epidemiologist and held leadership positions at the Georgia Department of Health, Texas Department of State Health Services, and the Philadelphia Department of Health. So you can tell he has a very strong practice background, and that'll come through in almost any conversation you have with him, and I'm sure we'll see that in his upcoming speech. He's a sought-after resource on public health, contributing his expertise through interviews and editorials published in the Washington Post, the New York Times, the Associated Press, Politico, amongst others, and you'll routinely see him on CNN, MSNBC, and NPR, Fox News, and other local radio and TV affiliates. He's published more than almost 100 peer-reviewed publications, and he's been cited thousands of times and co-edited 6 books, including one with us right now on maternal child health. He holds a doctorate in public health leadership from the Gilling School of Global Public Health at the University of North Carolina at Chapel Hill, and a Master's of Art degree in Socio-Medical Sciences from Columbia University. He also earned a Bachelor of Arts in Political Science from North Carolina State University. Please welcome me. Please join me in welcoming him. Dr. Krasushi.
Thank you, Dean Kahn. This is amazing. I'm so happy to be here with you today. Graduates, congratulations. This is an amazing day for you. And I love the term graduate. It's a great word, right? Because it simultaneously is about achievement and completion while also being about hope and expectations. And so I really wanted to be here so that we could celebrate your achievements, but also reflect on your readiness to take on the responsibilities of a field that has never been more essential or more challenged. Now, it's always humbling to be invited to do an address to graduates, and I take this very seriously. You see, I'm not fancy, I'm not famous, I'm not Oprah, so you all ain't getting a car at the end of this, right? And I'm not gonna, you ever see those things on TV where the speaker says, I'm paying off your loans? That's not gonna happen, okay? I'm not Tim Cook, I'm not Megan Thee Stallion, I'm just Brian the epidemiologist. But unlike those other people, what's important to me and why I wanted to be here is because, like you, I am a public health practitioner and I am proud of it. You and I share a conviction and we all believe in the importance of the public's health. So today, I'm not giving some generic address to a bunch of strangers. I am actually getting to talk to my newest colleagues in this field. We are all on the same road. I'm just a little older, so I'm further down the road than y'all. But I want to share with you today ideas and perspectives that I hope you can take with you as you continue your journey in public health. Most importantly, as new graduates, I'm not here to ask you to live up to the quality of today's public health leaders. I don't want you to respect what has been done or adhere to the tried and true practices of our profession. No, today I want to urge you to be better than all of us on the stage, to forge your own path, and to help drive the evolution of our practice. The profession that we've chosen is meaningful and rewarding, but let's be honest, everybody, making real change is hard. Poverty, injustice, gun violence, climate change, and systemic racism all put people at greater risk for sickness and early death. But those same conditions also fuel the wealth of others. You're going to face opposition from people and organizations that benefit from the status quo, from those who see opportunity where we see injustice. You graduate at a time of urgency and of significant political and cultural shifts. The 2024 election results, with Donald Trump's return to office and the nomination of RFK Jr. to lead the Department of Health and Human Services, underscores the complexities of our time. Yet you have an opportunity, if not an obligation, to carve a path forward that considers the many ways the nation and the world have changed and yet still persist in advancing health, justice, and equity, even when the winds are not at your back. For decades, public health has been an invisible force, working quietly behind the scenes, mission-focused and data-driven, and then COVID changed all of that. Suddenly, public health was in the spotlight, and while many people appreciated the value of our work, others lost trust, not just in science, not just in us, but in science itself. We must own that this happened in part because we made mistakes. But the great thing about a mistake is it doesn't become a failure until you don't learn from it. For too long, we've relied on this knowledge deficit model, assuming that if we just showed people the data and told them some things that they would learn, they would change their behavior, they would act rationally. But public health is not just about science. It's about people. And people make decisions based on values and emotions and experience, not just numbers. One of our challenges in our ability to define public health and articulate our value is our inability to consistently communicate what public health is. Has anyone ever played Pictionary? Remember Pictionary? It was a TV show. Yes, the folks in my age group are like, yeah, I remember Pictionary. If you don't know Pictionary, it was a game of teams where you would get a secret word and then have to draw it, and your teammates would guess the word. And really, the complexity of the game comes down to how easily the word is drawn. So let's take something simple. Let's say our secret word was hamburger. Okay? Could you draw a hamburger? Could you do that so that people could guess it? And you're starting to do it. You're drawing it in your head right now. I can see it. Right? It's like, oh, it's a this and then that, and I could guess that. Okay. So hamburger is something we could all draw. In talks I've done throughout the country with public health practitioners and leaders, I found that virtually everybody can draw a hamburger such that everybody else can figure out what it is. But what happens if we change that secret word? What if we ask those same public health professionals and leaders, and you who have now graduated, you are public health professionals, I'm going to ask you to draw this secret word, and that word's public health. What if I asked you to draw public health? What if that was the secret word you pulled? When I ask people to do this, most people put down their pencils and just look at me. Even those who have attempted, when they show it to other people around them, they didn't know that it meant public health. I've had yet to meet someone capable of drawing public health in a way that is universally understood. So regardless of how you feel about our next president. You must recall back in 2016 what he wanted to do to Hillary Clinton, right? He wanted to lock her up. And you know what he wants to do along the southern border. He wants to build that wall. But if someone asks you what public health is, it takes 4 days, 3 lectures, 2 books, and we still don't know what it is. We have to be able to communicate public health, because if we can't communicate it, those who have spent our lives and careers working in public health, then how will we ever expect lay people and legislators to know what it is? If we can't define public health, it remains abstract, misunderstood, ignored, and in peril. What if public health practitioners started telling people that public health helps every person in every county, in every corner of this country live their best lives? Would that open up conversation? Would it help people value public health more? These are the questions that you are going to have to grapple with. The COVID pandemic didn't just test our science, it tested our values, our relationships, and our ability to communicate. Public health guidance was meant to inform people, but often we devolved into binary for and us debates. Polarization hurt our credibility. Take, for example, the origins of the COVID virus. Initially, those who said there was a lab leak were labeled conspiracy theorists. They were dismissed. They were removed from platforms, silenced in discussions. But as evidence emerged, that explanation warranted reconsideration. We don't and may never know conclusively how the COVID pandemic started, but the lesson is that public health practitioners cannot afford tribalism. When we dismiss others and politicize ideas without evidence, we erode public trust. This same polarization played out across pandemic policies. Debates about masks and vaccines and lockdowns turned into battles of us versus them. Public health became a symbol of control for some and a savior for others, when honestly we are neither solely one or the other. In that environment, discussions were replaced by debates, and accepting new facts or evidence from one side meant losing for the others. Science is not a sport. We don't have winners or losers. We don't keep score. But we fell into this trap of political orthodoxy rather than the humility and flexibility that science demands. This happens because even we, as public health professionals, are not immune to tribalism. The events of 2020 tested public health in unprecedented ways. The COVID-19 pandemic and the national reckoning with systemic racism collided, forcing us to confront hard questions about our priorities and our values. George Floyd's murder, along those with Ahmaud Arbery and Breonna Taylor, ignited a wave of protests throughout the nations that were often conflicting with existing COVID guidance. Public health leaders argued that the risk of not protesting systemic racism outweighed the risk of COVID transmission. 1,000 public health practitioners signed an open letter stating that racial justice protests were vital to the national public health. But these same leaders had previously criticized lockdown protests as reckless and dangerous. This inconsistency fueled mistrust. Public health practitioners made value judgments, not scientific ones. We didn't support or believe in protests targeting lockdown orders, and so we used science to paint them as dangerous and reckless. When it came to racial justice protests, the risk didn't change. Our support of the protesters did. We could not clearly articulate why one gathering could be justified while another could not. In doing so, we changed how we were seen by the public. No longer were we objective scientists, but political actors. When public health appears partisan, trust erodes. And without trust, public health cannot succeed. By conflating value-based judgments with science-based recommendations, we make it harder for the public to trust us. These contradictions cost us dearly, and we cannot let it happen again. As you go forward, public health must be grounded in transparency, evidence, and consistency. We cannot allow our guidance to be shaped by ideology or by partisanship. Our messages must be clear. Public health is not about ensuring health for a few, but for everyone, regardless of race, political affiliation, or belief. It's not about control or politics. It's about saving lives. When the next crisis comes, and it will, we will need the trust of the public. So it is your job to rebuild that trust. And to do that, we must commit to clear and consistent communication, to transparency in our decision-making, and to humility to adapt when the science changes. We also need to build better partnerships. Disagreement with policy is not disagreement with science. Science thrives on debate and continual refinement. We have to engage our critics, listen to concerns, and clarify evidence. We have to build partnerships across our differences. The change that we want at the scale that we need is going to require different perspectives and combined power. During COVID-19, my team partnered with conservative leaders to promote vaccination. We might not have shared political beliefs, but we shared a mission to get people vaccinated. Real change requires partnership, not partisanship. We need to untangle a complex web of social and economic factors that influence our health, and no field can do that alone. Graduates, the challenges ahead of you are immense, and this work is not going to be easy. As you get out into the world, please remember that public health is not about being right. It's about being effective. It's about saving lives. The world needs you now more than ever. When the work is frustrating, when bullies abound, do not shrink. The systems that you want to change, they're going to fight back. The road ahead is going to test you, but you are ready. This is an amazing college with fabulous faculty. They've prepared you with all of the skills and knowledge that you need. You are here because you are responding to a calling to be the kind of leader that we need in public health so desperately. It is time for you now to meet that calling. Be clear, be consistent, be humble, build trust, and above all, be better than all of those who have come before you. I said to you earlier, you are now my colleagues. We're here for you. All of us are here for you when you need us. When you have questions or concerns, send a text, give us a call. You are part of a phenomenal group of people who have taken to public health to prioritize the lives of others. It's not me, it's we. That's how we succeed as a society. That's how, if I may, we make America healthy again. We prioritize the we and not the me. You have done something amazing. You've done something very few have done, to be here today and graduating. Thank you for joining this field. Thank you for taking up the mantle. I want to congratulate you, class of 2024. Your work begins now. Thank you very much.
Thank you for your wonderful remarks, Dr. Castrucci. We're honored to have you with us today. Now it is my pleasure to present the student award portion of our ceremony. Dean Kahn will present the awards to the recipient, assisted by Jessica Sharon, our Assistant Dean for Student Affairs. As I announce your name, please come forward. All of our Master of Public Health and Master of Health Administration students are required to conduct a capstone project to complete their degree. The Outstanding Capstone Award is given to an MPH or MHA student who's demonstrated excellence in the mastery of principles, values, and practice of the profession. The student's project should exemplify the mission of the College of Public Health, contribute to the improvement of the health of a defined population, and make a significant contribution to the work of the organization or community in which it's conducted. This year's recipient is Janie White, a Master of Health Administration graduate. Her capstone involved the development and application of a strategic plan implementation framework for the Andrew County Health Department in rural Northwest Missouri. The project aimed to bridge the plan-to-action gap by creating a detailed implementation roadmap to ensure the health department's strategic objectives are operationalized effectively over the next few years. Congratulations, Janie. Now it's time to recognize our graduates. All graduates from summer and fall 2024 will be recognized today. Jessica Sharon is assisting Dean Kahn in congratulating the graduates who are able to be with us in person and presenting them with a special gift, and those who could not be here today will receive their will recognize our Doctor of Philosophy students. The PhD is a high-level degree earned after an extensive period of graduate-level study, and it culminates in the creation, submission, presentation, and defense of a research dissertation. This degree is awarded by the College of Graduate Studies. These students will be hooded tomorrow at the Graduate Studies Convocation ceremony, but we want to recognize and celebrate them here today as well. Along with the name, I'll read the student's area of study. Students, please come forward when I read your name. Viabavi Monet, Health Services, Research, Administration, and Policy. Fall 24, Rima Mohammed Abalushi, Health Services, Research, Administration, and Policy. Aiden E. Quinn, Health Promotion and Disease Prevention Research. Harlan Russell Sales, Biostatistics. Congratulations to our PhD graduates. Next, we will recognize our Master of Science in Biostatistics students. This degree is also awarded by the College of Graduate Studies. Our Master of Science students will also be hooded tomorrow at the Graduate Studies Convocation, but we want to celebrate them here. Master of Science in Biostatistics, Fall 2024, Mazen T. Abdelganeh. Alex James Van Lent. Congratulations to our Master of Science in Biostatistics students. Next, we will recognize our professional students. Part of the recognition for completing a master's or doctoral degree is the hooding of the graduate. The hood is a special part of the academic regalia, which denotes scholarly and professional achievement. Placing the hood over the head of the graduate signifies their success in completing the program. The color of the hood denotes the degree program. In addition to the hooding, we will recognize the outstanding academic achievement of our professional students. Honors are awarded to those who've shown special proficiency and have excelled in their studies. Students receiving honors will be recognized with a medallion that is placed over the head of the graduate. There are 3 categories of honors, and they are conferred in the following way. The degree with highest distinction is awarded to students with a UNMC cumulative grade point average of 4.0. The degree with high distinction is awarded to students with a UNMC cumulative grade point average of 3.85 or above. The degree with distinction is awarded to students with a UNMC cumulative grade point average of 3.75 or above. So now we will recognize our Doctor of Public Health graduates. DRPH graduates have completed 54 or more credit hours of coursework, including 300 hours of practicum experience. They have also prepared, submitted, and defended a practice-based dissertation before their peers and faculty. We're incredibly honored and excited to recognize them today. Dr. Sharon Metcalf, member of governing faculty and marshal for today's ceremony, will be assisting the student's advisor in the hooding of Doctor of Public Health students. The official hood color for the Doctor of Public Health degree is salmon pink, and the scarlet and cream represent the colors of the University of Nebraska. All right, Doctor of Public Health, summer of '24. Anthony Jason Remington Blake, epidemiology, honors with high distinction. Patrina Lynn White, Emergency Preparedness, honors with high distinction. Now we will recognize the Master of Health Administration graduates. MHA graduates have completed 41 or more credit hours of coursework, including 6 credit hours of practicum and capstone experiences. The official hood color for the MHA degrees is sage green, and the scarlet and cream represent the colors of the University of Nebraska. Ms. Laura Vinson, Director of Master's Programs, will assist with the hooding. Master of Health Administration, Fall 24, Taylor Andrew Boney, honors with highest distinction. Heather Ann Johnson. Daniel James Warman, honors with distinction. Janie Ellen White, honors with highest distinction. Now we will recognize our Master of Public Health graduates. These students have completed 42 or more credit hours of coursework, including 6 credit hours of practice and capstone experiences. Along with their name, I will read the student's concentration. The official hood color for the Master of Public Health degree is salmon pink, and the scarlet and cream represent the colors of the University of Nebraska. Students, please come forward when I read your name. Summer 2024, Atia Ahmed, Public Health Administration and Policy, honors with high distinction. Jessica Ann Cleghorn, Maternal and Child Health, honors with high distinction. Brittany Nicole Hawking, Epidemiology, honors with high distinction. Caleb Otto Kudis, Emergency Preparedness, honors with high distinction. Rose Selavi LeMay, Emergency Preparedness, honors with distinction. George Tai Liu, Biostatistics, honors with high distinction. Mamelo Makili, Maternal and Child Health, honors with high distinction. James Marlin McCluskey III, Epidemiology, honors with high distinction. Jonathan Casey Meyer, Epidemiology, honors with highest distinction. Tanya Notel, Emergency Preparedness. Jacqueline Stewart Sims, Public Health Administration and Policy, honors with high distinction. Elma Fernandez Vasconcelos, Epidemiology. Seth C. Weldon, Public Health Administration and Policy. Kristen Elizabeth Westmore, Health Promotion, honors with high distinction. Fall 2024 graduates, Rebecca J. Campbell, Emergency Preparedness, honors with highest distinction. Schaefer Kathleen Marie Flowerday, Environmental and Occupational Health, honors with high distinction. Mallory Nicole Hayes, Biostatistics, honors with distinction. Jacinia Hincapi, Epidemiology. Lauren Marie Haran, Epidemiology, honors with distinction. Sanish Maherjun, Epidemiology, honors with high distinction. Caitlin Ann Mitchell, Epidemiology. Jamila Nasser, Biostatistics. Teresa Quinn Neo Nguyen, Maternal and Child Health, honors with high distinction. Rachel Elizabeth Norton Turk, Health Promotion, honors with distinction. Mona Melvin Pereira, Epidemiology, honors with high distinction. Robin K. Thomas, Epidemiology, honors with high distinction. Jacqueline Renee Van Camp, Maternal and Child Health, honors with high distinction. Sarah Darlene Ward, Epidemiology. Alexandria Michaela Welch, Epidemiology. Angelica Christine Zarate, Environmental and Occupational Health. Congratulations, MPH graduates. The final group of graduates we will recognize today are those who have completed a graduate certificate program. Certificate programs are designed to meet the needs of developing or practicing public health professionals. Unfortunately, none of our certificate graduates could join us today. Summer 24, Shanice L. Cummings, Infectious Disease Epidemiology. Chun Bao Dang, Public Health. Shuya Gayo, Public Health. Mark Edward Hamill, Biostatistics. Anning Huang, Public Health. Yifi Ma, Public Health. Madhuri Morgan, Public Health. Stephanie Namatama Siuimbwa, Public Health. Megan Nicole Stacy, Public Health. Zizi Sun, Public Health. Tiandai Wang, Public Health. Ziyi Yan, Public Health. Aishu Zahid, Public Health. Fall 24 certificate graduates. Devarut Bakhtu, Public Health. Alexander Gregory Burbach, Public Health. Megan Lou Kataria, Public Health. Brian Joseph Hess, Public Health. Suhan Lee, Public Health. Kara Nicole Marshall, Emergency Preparedness. Chloe Nicole May, Public Health. Elizabeth Marie Rhodes, Public Health. Jack Christopher Senna, Public Health. Kevin D. Sullivan, Public Health. And Mardo Tar, Public Health. Let's congratulate all of our graduates one more time. Now I would like to invite Dr. Jessica Seaman of the College of Public Health's Alumni Engagement Council to welcome our graduates as alumni.
2024 graduates, you are finally here. Today's the day. You worked so hard over these last few years to get where you are today. You've spent many early mornings, late nights, studying, writing dozens of papers with evidence-based sources in APA format, taking several exams, giving presentations to a variety of audiences. You've had experiences out in many local communities. You've had conversations on many different topics with your peers, faculty, and staff. You haven't chosen an easy journey here, but I can guarantee you that you've already made a difference among those around you and will continue to do so. Today, you may be filled with so many different emotions. Excitement for your huge accomplishment, rightfully so, but also nervousness of the future. Some of you may have already accepted new positions. Some of you may be continuing on with your current job. Others continuing with more education. You all have a new set of public health skills that you can use. Others may still be looking for next steps that you will take. But wherever you are, it is okay. It'll all work out because your future is bright. You've got the support of hundreds of UNMC College of Public Health alumni behind you. You've got a new public health toolbox with many tools and skills that will help guide your way. You know more than you think, but there's so much more to learn as this world is continuously evolving and changing. There is great hope on the horizon as we look ahead, because tomorrow, UNMC will confer degrees to our newest public health warriors, and that is you. You should be incredibly proud of yourselves as you've overcome challenges and barriers. There will be more, but today, let's celebrate your huge accomplishment. As you leave your role as a UNMC student, I'm very excited and eager to welcome you to a new team that you're a part of, and that is a soon-to-be alum of the UNMC College of Public Health. Together, we as alumni, we can change the world one step at a time. Some of you will be collecting, analyzing, and disseminating data. Others will be working directly with patients, others with populations. Some will be out doing health education in the field, others behind a desk. And yet others will be working on strategic planning, needs assessments, health policy, and more. The possibilities with public health are limitless. You will be part of making this world a better place for all and following in the footsteps of many great public health accomplishments that have occurred over the last century. After these next few days of celebration wear off, please don't forget you have the support of UNMC College alumni, including myself, behind you. We've all been at this crossroads before. There's many things to look forward to, but also many challenges that will come. We invite you to participate in alumni activities and know that you will always have a seat at our table as UNMC College of Public Health alums. As you settle in after post-graduation and figure out where life's gonna take you, don't forget to stay up to date on the alumni website, social media pages, to join us with networking and professional development opportunities, both in the local Omaha area and beyond. Another great resource, and is one of my personal favorites, is the UNMC Alumni Connections page. This platform can help you easily connect and stay connected with those who you've met, network with other alums around the world. This was one of those opportunities that I put on my checklist and I was kind of hesitant to do because there's so many things to do in life. But I'll never regret it because I met one of my most trusted mentors and resources who's a public health warrior, and I know that you can do the same. The possibilities are endless. As you settle into the next chapter, know that students will now be looking to you for guidance and support. There's so many opportunities that you can join. You can speak in a course, mentor students, do mock interviews. The next generation depends on all of us, including you. So in these next few months, please don't be afraid to reach out to anyone on the Alumni Council. We're here to support you. We look forward to having you as part of our team. So on behalf of the alumni of the University of Nebraska Medical Center, College of Public Health, I welcome you to this great profession of public health and to your new role as a UNMC College of Public Health alum. Congratulations.
Thank you so much, Dr. Seaman. I will now invite Lauren Haran to give the benediction.
As the ceremony ends, we have so much to which we are grateful for. We have truly been blessed by many things, including the fellowship of our classmates, the guidance of the faculty, and the love and support of those assembled here today. We ask you to keep us safe, both as we leave here today and wherever our journey may lead. Thank you.
Thanks so much, Lauren. Graduates, today is the culmination of your hard work and dedication. We are extremely proud of you for joining the field of public health at one of the most important times in history. As you've heard today, now more than ever, we need leaders to create innovative solutions to respond to new and existing threats and reimagine our public health system. The work will be difficult and humbling, but also rewarding. And we know that as College of Public Health graduates, you have the skills necessary to be the future leaders and change agents we need right now to assure the conditions so all people can thrive and be healthy. For many, completing a graduate level education would not be possible without the support and encouragement of family and friends. So graduates, please be sure to share your appreciation for family and friends who've supported you along the way. And on behalf of the College of Public Health, we applaud you and thank you for your support and contribution to each of these graduates. Before we conclude today's ceremony, I want to thank the individuals who've assisted with making this special event happen, as it takes a significant amount of time and dedication. Thank you to our marshals, Dr. Sharon Metcalf and Dr. Aaron Yoder. Special thanks to those who organized today's ceremony, including Jessica Sharon, Hillary Peshik, Ron Glenn, and Paige Anderson. Thank you to all of our faculty and staff volunteers, and a special thanks to our guest speaker today, Dr. Brian Castrucci. Concluding the ceremony today, we hope everyone can join us for a reception, which will be right out here in the lobby, to celebrate the incredible achievements of these new graduates. Now, would our graduates please rise? Please join me in congratulating the University of Nebraska Medical Center College of Public Health graduating classes of summer and fall 2024. Thank you. If you're able, please stand for the recessional.